what's the deal with Sculptra nodules? There's a myth that circulates out there that Sculptra injected using competent modern injectable techniques has a significantly higher risk of developing delayed onset nodules under the skin versus traditional hyaluronic acid fillers. And the simple truth is that when the injections are done competently and in the correct plane and using the correct modern dilution techniques, there is no higher risk of developing delayed nodules with Sculptra than there would be with hyaluronic acid. In both cases, the risk is under 1% and even lower when Sculptra is done in the hands of a skilled injector. Now, the two key sort of determinants, apart from proper dilution technique, that can sort of modify the risk of these nodules, part of that risk is injector related, and it comes down to specifically, is Sculptra injected into the right plane? If it's injected too superficially, i.e. into the dermis, or too deeply, i.e. into the deeper fascia, both of those can result in an increased risk of Sculptra-related nodules. Sculptra should be injected into the subcutaneous tissue. There's also patient factors that contribute to the risk of nodules. Namely, does a patient follow the 5-5-5 rule for massaging their Sculptra after their treatment? Are they massaging it for 5 minutes, 5 times a day for 5 days? If all those things are done correctly, the risk of nodules with Sculptra is very minimal.